Hey, I'm Dr. Jordan Heimer with Nuvia Dental Implant Center. My current role is the lab director. I've been the head of restorative, and I've also done thousands of these surgeries myself. I wanted to make a little video for y'all to kind of go over the differences between removable dentures and implant treatment. That way you can kind of decide which treatment option is best for you along your dental journey. So I kind of wanted to go over, the different styles of dentures that you could get. There's quite a bit more, but let's get into kind of the main four, right? So the main four styles of removable prosthetics that you may see or may get treatment planned when you walk into a dental office is a partial denture, you have what's called an immediate denture, you have a premium denture, or an easy denture. And they all have different uses and different time frames throughout kind of a treatment plan. So a partial denture, as you can see here, it's just made up of portions of teeth. This would be a great treatment plan for somebody who, hey, has some healthy teeth left in their mouth. And it's like, you're not ready to have everything removed, And so what we do, and we can do this in a kind of as dentists, we can kind of do this in a number of different ways, is that we can either utilize some of the healthy teeth, and those kind of act as little supports for this partial denture, and whether they kind of clip around or they function, as you can see here, they've got little stops placed on them, and that prevents this thing from moving and rocking a lot. There's always a little movement in all of these because they're removable, right? It's not fixed on anything. These can be made out of, as you see here, this one's got a metal framework, but you may hear some called Valplast or some acrylic, flexible. It just depends on kind of where you are gonna land with a treatment plan and how long you're planning on keeping this thing in, right? Like, if it's made of metal, it's kind of more of a long-term solution. It's something that a doc is gonna use, and they're gonna use this for either A, you've got those healthy teeth and we just wanna replace a couple of them and give you some really good chewing efficiency for a long, long time. This is a great solution. It allows you to keep your teeth. It allows really great chewing efficiency. If you get it made by a doc that's really skilled, this can fit well and function for a long, long time. A partial denture is a really great solution if you don't need to have all your teeth taken out, because a lot of patients that we see, even in our clinics on a daily basis, like, they've got a lot of healthy teeth and they don't need them removed. Just because somebody tells you, that you have some bad teeth doesn't mean that they're all bad. And so you should try and save the ones that are good, and this is a good option. An immediate denture is a hard one to talk about, because this restoration is used where, yeah, you're gonna have all the teeth taken out. You need every one of your teeth removed. This is kind of like the Band-Aid for that first day. So unfortunately though, after you take teeth out, from the surgery side, people swell. Swelling occurs after surgery. You're trying to make this thing called an immediate fit on something that hasn't healed yet. It is swollen. So this can be a challenging situation for patients to live in, and it's really meant to kind of be a segue into this premium denture after a number of months of healing. But the way that this is fabricated is so the docs would send your models to a lab. And they're gonna tell the lab where they want your new teeth set kind of in your arch after they take all of their records. And then the lab kind of assumes after they take your teeth out, where is that initial bone gonna remodel at, right? And so then they're gonna wrap the denture kind of around your models and the records that the docs have given you. What that does, a lot of times it leads to a little bit of a bulky prosthetic. And that bulkiness will be felt after surgery. And because your mouth over those first couple months goes through significant changes. I mean, we're talking, the swelling happens for the first 7 to 10 days. Well, then that swelling reduces. Now this thing doesn't fit again, and then once again, now the bone will heal over the next couple months, the fit will change again. So an immediate denture is more, you think of it as like a Band-Aid. Think of it as like kind of the vehicle that gets you from that first day of surgery to get those bad teeth out to where we can start fabricating a much better fitting denture for you. And that's what kind of leads you into this premium style of denture. This is something that's made months after surgery. You've kind of finished your healing process. We as docs see where the bone is settled, how the gums have healed, what anatomy we have left to work with. And this particular prosthetic in the hands of a skilled provider can be made to fit really, really well. Like, especially the upper. An upper denture, with a patient with good bone and good support can actually fit really, really well. And we see it all the time in our clinics where patients like, look, I'm happy with my upper denture. I like the way it fits. I like the way I talk with it. I like the way it looks. Like, I don't want to change that, right? So this can be a wonderful product for you. If you're, if you're shopping around and you find somebody that can make these for you, like, great. A lower denture, whether it's immediate, whether it's premium, easy, a lower full denture is always kind of a challenge to make and make well from a doc standpoint. The denture really relies on suction to hold it in, and on the lower jaw, there's a little less real estate for us to work with as far as obtaining some of that suction. You also have the tongue, the cheeks. There's a lot more movement in the floor of your mouth, and so getting a lower denture to fit well is a challenge. And I've made thousands of dentures as well. Like, I worked at a denture clinic before I even worked at Nuvia, and so as good as we could make them, even as nice as we were making them, patients still could potentially struggle with lower dentures. I've seen many that have enjoyed their time and they're like, no, I'm happy with things too. But the general consensus is the lower denture is always a little more challenging for patients to both live with and docs to fabricate. That's a lot of times why you may see on some of your treatment plans that a doc is planning to put 2 implants into a snap-on denture. That's another style that where you can take, like, say you have a premium denture and it's done well, and you just want that thing to have a little more stability in your mouth, and you're not ready to make the leap into, say, an implant prosthetic, right? And you just want something that's like, hey, I need a little better solution. I want it to be a little more stable. My lower keeps popping out when I talk at functions, right? Docs can go in and we can put 2 implants or 4 implants in the lower jaw if you're a candidate and you have the bone for it. And then we can just put almost like little snaps, like you'd see buttons on a coat, is essentially how I tell my patients, right? It's like, and one end goes in the denture, one end goes on top of the implant, and then we just snap that thing on. It has an audible snap, it'll hold it in place, and it will really, it can really enhance the function of a premium denture. So if you're in that situation and you've got some dentures that you like, but you're struggling with, with one of them coming out, it might be worth looking into, a doc that might be able to just place 2 or 4 implants in either the lower or the upper jaw and put those snaps in there. And man, that can be a really wonderful solution for you if you're not, if you're not looking to go through another bigger surgery to get, an implant style prosthetic. An easy denture, this is something that's either done at, you can almost buy them on Amazon. You can get them at some other, other locations across the country. The challenge with this is that, like, the rest of these styles, a dentist is taking records and a lab is custom fitting things. They're looking at, what does my arch look like? Where do the teeth need to go in my mouth to enhance my speech, my chewing, the aesthetics of all of that. This is just a stock set of prosthetics that you don't know how the arch is going to fit. You don't know where the teeth are going to be positioned vertically. You don't know if the bite's going to be all correct. This style is, once again, it's like if you're really in a tough spot and you need to get, you really just need to get something done, it can be done, but it's a kit that's kind of like it can almost be like a boil and bite. You can heat some you can heat some of this material up, kind of get them in your mouth, form them, and then you use your mouth and your lips and your muscles to kind of conform these borders as best as you can. But it is going to be challenging to keep that thing in, or really get it to, it can be a challenge to get it to look nice, right? But once again, I've seen these fit patients just as well. Like they've come into my offices before and they're like, oh, I've got this thing and man, it's been working for me for years. And I'm like, man, I don't know honestly if I could make one any better. It really is. It's really kind of embarrassing sometimes as a doc when you see some of these quick solutions and you're like, man, they really did a good job with that, And so it's like, and then I'm under the gun to be like, man, I got to do better than this, and that can be a nerve-wracking moment for any doc. But from a patient's perspective, I mean, if you're really in a pinch and you're pretty handy and you can work with things, this can be another great solution for yourself. Those are just kind of the different styles of removable prosthetics that are out there, and they all serve a really great purpose and all can kind of be enhanced through different procedures. So it's worth kind of talking through your providers and your dentist to see which one would be best for you. All right, let's get into some of the major pros and some of the benefits you would see by having some of these infected teeth removed, right? Like we all say the mouth is the gateway to the body, right? And so anytime you have a number of bad teeth, gum disease. I mean, that's the same thing as having an infected leg, an infected arm. I mean, most people, if we had infections on our arm or leg, like we're not just gonna stare at it, right? We're gonna go do something about it. And unfortunately, in this world, the mouth can kind of be as secondary. And so a lot of people kind of let this disease progress, right? And then it can start to affect your overall health. And so some of the pros, right, are the bad teeth and gum disease. They can just be a source of ongoing infection, inflammation in the body, and that can be linked to many other systems. As we said, the oral health is linked to the whole body health. Everything comes through the mouth, and if you're chewing food, anything you've got bacteria in there, right? Anything you chew with those bad teeth, it can then be carried as you go through your gut, and kind of spread out through the body that way. And that's where the benefit of having your bad teeth removed, right? Is like getting those teeth removed, getting them replaced. You're removing that source of chronic infection and bacteria, and you should just start to feel better once those teeth are gone. Kind of wanted to run over some of the timelines for a couple of the different prosthetics that we were talking about in the, just previously there in the video, right? So kind of want to walk through the timeline of an immediate denture. And so I kind of touched on this a little bit earlier, but a little more detail, right? So the immediate denture, it starts kind of with the planning before surgery. Like we said, the dentist will take some records, they'll send that to a lab, they'll work with your lab to kind of position the teeth. The lab then will kind of use wax or however, whether they're doing this via traditional impressions that everybody hates, whether they're using a intraoral scanner, that's either gonna be done digitally or fabricated in a more traditional manner, right? Doc will do that, the planning, but they'll get a denture that's ready to go for the day of surgery. So the day that you're having your teeth removed, right, with an immediate, they'll have a denture that's ready and built. So teeth will go out, they'll place the denture in your mouth, either, I don't know if you're getting this done sedated, if you're doing it awake, that kind of works between you and your oral health care provider. We'll place that immediate denture, and then we'll ask you to keep it in for a couple days. Reason being is that when that swelling happens, this acts as kind of like compression socks. So it allows, when that swelling's happening, that denture, with it staying in, it'll kind of keep the compression, and keep something on that. It's a fresh wound, right? You just had surgery. And so we ask you to keep that in for a number of days before you take it out. And that will help enhance the fit of that while you're during your healing process. You do go through, 3 to 4 to 6 months, depending on everybody's situation, of that healing process during an immediate. And during that time, the gums are going to heal, they're going to heal back together, the bone will kind of remodel and reshape as your body, the body really doesn't like sharp angles in the mouth, so it's going to kind of remodel things and smooth it all out. And what that can mean for you during your process, and everybody's a little different, right, is that even though there's a healing process of 3 to 4 months, you may see your dentist on every 2 weeks, every month, and they're gonna sit there and kind of adjust your denture. And whether that can be done either by, if we see a sore spot, we'll remove that pressure point. If it needs to be relined, we call it, we can use a hard or a soft material for that. That'll add material to kind of enhance the fit. But you can probably expect that if you're getting an immediate denture. That's nothing, doesn't mean the procedure went wrong. It doesn't mean anything's wrong with, with what was happening. It's just the nature of having that procedure done. And so we try to keep up with you as best we can as that body's going through those rapid changes in the first, 3 to 4 months of healing. Then once that first 3 to 4 months is completed, and a lot of us will take some x-rays and kind of see how the bone is remodeled and see the shape of things. That'll give us a kind of an idea of like, all right, is this patient at a spot where we feel they've healed well enough? And then we'll restart the process to remake that premium set of dentures. And some docs will take an immediate and they'll do what's either called a rebase with their lab, where if you like where the teeth are in their position, the lab can actually remove the acrylic, keep the teeth in the same spot, and then just put a brand new pink base on that fits it really well to how you've healed. Or we restart, or say we missed the ball and that you don't love the look of the teeth, right? We would restart the process with new records, and that's new impressions, new scan, new wax ups, all of that. And that will give you, and that goes through another, depending on every doc has a little difference on how long they can get it done, but it can be, a couple weeks to a couple months. And, in 6 to 8 months time from your initial surgery date, you would potentially have that premium denture that's supposed to fit really nicely compared to that immediate denture, and that'd be all completed. just kind of wanted to review the process and the steps where you would go through for having that quality denture, that premium denture made after you're done healing after your surgery, right? So the first step would be reimpressions. Alginate, we call PVS, which is kind of the plastic material, or an intraoral scan. And there's no good or bad way to have that done. If some docs can make a really nice denture from a digital scan, and some docs still need to use impressions, right? It's just whatever's comfortable working in our own hands, and what our lab, what the lab is comfortable records getting, we'll work with them, and all of them can result in a great prosthetic. After that, we do what's called a jaw record, and that's where the lab will actually send us, we'll call them wax rims. We'll get that back, and it's a base, kind of like the pink base on a denture, but then there's just a piece of wax in there, and we place those and kind of shape that in your mouth, and it kind of helps us kind of visualize where we would want to position the teeth. We can kind of estimate speech, we can see some of the phonetics that are in there, some of the aesthetics, but it also allows us to capture a really accurate bite. Denture stability is really crucial to have the bite done correctly. Like if because dentures move, right? Like if a doc takes a record and the teeth all come together in the exact same spot in the exact same time, that will push the dentures against your gums and really make them stable. If for some reason we take a bite, or say the lab delivers us something where one tooth hits first on one side, that can cause one of the dentures to kind of pop, or it can cause it to rock, right? And so that's something we really pay attention to when we're taking this jaw record appointment, and that can really affect the final fit of your prosthetic. The try-in step is so those wax rims actually come back from the lab, and they've got denture teeth placed in the wax, and it almost looks like a denture at this point in time, right? And that allows us to place them into your mouth and go, all right, do you like the look of these? Do they sound good to you? Do you like the feel of them? Do you like the way the gums are shaped, right? It really gives you as a patient an opportunity to tell the doc what you like and what you don't like. And because after that, it goes into processing, and this is where the lab is making that. They're literally taking this try-in, and they're going through a number of different processes. We don't need to get into that to video, because there's a number of different ways we can go into how a denture is made, but it's a direct copy of that try-in, or wax try-in, aesthetic try-in, whatever your doc wants to call that. So that takes a couple weeks, just because it has to go back to the lab, process it, polish it up nicely, and then it comes back to your doc, and then it's your delivery and adjustment day. And that day is place the denture, make sure everything fits, make sure it's comfortable to you. And it's not even really that unusual that even after all of these records, when we go to place this, you sit in the chair, and a lot of docs, like I used to have my patients sit there and kind of chew on cotton rolls or something in the office, just to see, like, do they develop any hot spots? Do they develop any sore spots, right, while they're sitting in my chair? That way I can make those adjustments while you're sitting there. And then I would always kind of see my patients for another 2-week or a 4-week visit as well, just in case, to double check on them, like, did we develop any sore spots from them using these things? I mean, it's like kind of like getting a new pair of shoes and you got a new pair of boots, right? You got to go break them in. You got to see where it's going to cause some sore spots. And the mouth is a spot, the tissue kind of compresses, the tongue is moving. So there's a lot of moving parts in there. So we go through a number of different adjustment appointments just to make sure that these are custom fit for you and they're as comfortable as we can. Here at Nuvia, like, we don't really make dentures. We have a denture, and for some instances, when we need to use them, but our focus is on dental implants, and that's kind of where we have just kind of specialized, for our company, and seen that that's the type of treatment we like to deliver. Okay, obviously, I mean, I don't have dentures, but I do kind of want to go over what some of my patients have told me that, that first time that they ever received that first prosthetic, and what does it feel like, right? And what are the things that I've heard, like, how do the adjustment, and so, but what do dentures feel like, right? I mean, obviously you're going from a single row of teeth, and now we're putting in a piece of acrylic with teeth on it, and it wraps around the gums, right? So it can cover the palate, it can kind of go up into the nose area, so it can be kind of foreign at first, right? But it just takes time, and then a lot of patients will adjust nicely to it. Obviously, you've got your tongue and your cheeks now have a new cage. We've and a lot of times too, patients with missing teeth, like, that tongue can expand into those areas, right? Like, it can grow, and all of a sudden, so now you've got this wide tongue, and now we're putting the teeth back where they need to be. and the tongue's like, what the heck's going on here, right? It's just like, man, this thing is, now I'm biting my tongue, my cheeks. Your body's just really got to learn its new boundaries that it has to function in. And, you know, a lot of times docs will do try-ins and let you wear things for a couple, you know, for a little bit because of this particular point right here. It's like they want to see, you know, can a patient, you know, can they tolerate where we're going to put the teeth, or do we need to potentially move them to help you adapt to, you know, the life in a prosthetic, you know, kind of. But that's a big one right there, is the body learning its boundaries. Obviously, there are going to be temporary changes in speech. You know, the teeth have a huge role in all of the sounds that we make. As docs, we're studying, we're giving classes on phonetics and speech, and how the teeth and the tongue and everywhere where they play roles in this, because during very specific sounds, the teeth will hit the lips in a specific spot, the tongue will touch the roof of the mouth, or the mouth, you know, the lips will cause a, you know, a certain shape. All of that interacts together, and now we're covering up some of those spots with the base on the denture. The teeth are going to be in a new position, right? That can cause a lisp. That can cause some changes in the way you sound. But the nice thing about a lot of dental procedures, as opposed to like some of the medical procedures out there, is like you got to pay for a physical therapist on the medical side. You're your own physical therapist on the dental side, right? Because you can sit there, you can sing in the shower, you can read out loud, you can talk to friends. And the more you do that, the more the body and the muscles will adapt to the new prosthetic that's in there. And over time, you'll start to sound like your normal self again. And then the last kind of point is the, you know, extra saliva. It's kind of like, you know, you put a cheeseburger in your mouth, you're gonna salivate, right? You know, the body thinks, hey, it's a piece of food, right? So with the dentures, even partials, any of those dentures, the body's gonna sense this, like, oh man, this is something extra. I'm gonna start to salivate a little bit more. And so you might get some extra saliva for those first couple days, couple weeks. I've seen it a couple months as people adapt to it, right? There's not really set timelines in the world of medicine. Everybody's a little different. We try to do our best to estimate where things are going to go, but realize that all of this has a range to it. And your doc should be working with you to kind of help you understand where you're at in that path, and either how to help you adapt to that or change things to make it work better for you. Okay, I kind of want to touch on some costs. Obviously, there are big changes across the United States in different areas, even different areas of the country, you know, charge different prices, different offices, different qualities, different materials, right? So just understand that these are just estimates; they're not exact. So you know, you'll have to work with your local provider to understand what their costs are. But you know, starting a mid-range, you know, set of dentures, you're probably looking at somewhere around, you know, $500 a set, you know, $499, somewhere in that per arch. So when a dentist says that, it means per the top arch and per the lower arch. Your affordable dentures, your economy set, a whole set could be somewhere in the $800 range. So you're looking there at $400 per arch. Some of your DIY, the boil and bite stuff that we talked about, we called it the easy denture. That is going to be somewhere around the, you know, $200 range is what you can look on, I think Amazon, where you get something like that. Some of the, you know, your more premium traditional dentures, that, because there's a lot more steps involved in that, and the materials that we use are significantly different. Obviously, the price does go up with that, and those can range anywhere from, you know, $4,000 to really whatever, you know, the dentist is going to charge. You know, $12,500 is an estimate, but once again, it's a huge varying cost on those. And then partials. Same thing, whatever material it's made out of, how long they expect this thing to last, the permanency that the doc is, you know, expecting out of this, that will affect the cost, but you're looking anywhere between $900 to $2,500-ish. I want to talk about, I'm going to call it challenges. I don't know if con's the right word for this, right? And so, because having, you know, infected, bad teeth removed, there's not really a con to that. That's an investment in yourself and your own health, right? But some of the challenges that come with, you know, a removable prosthetic, bone loss, and what we mean by that is just the body will invest energy to keep things around it thinks it's using. So like when you have a tooth, the tooth root, when you chew on a tooth, there's a signal that goes to the body that tells your body, it's like, hey, I'm using that bone, like it needs to be saved, it needs to be rebuilt. Right, and so it's like I need to keep that tooth in place as long as there's no signs, you know, no infection or bacteria, right? With a denture, when we pulled the teeth out, now the dentures are just sitting on the gums, And obviously that compression of the gum tissue, what that can do too is the body's like, you're kind of continually compressing the blood flow of the gums. And over time, this is not something that happens immediate. We're talking years and years and years for a lot of people. The body will also start to realize, oh, the teeth aren't there. I don't need to invest the energy to continually rebuild these jawbones because there's nothing inside of those jawbones that I'm using it to function, right? So this is a slow process. This isn't something that's going to happen, immediately, but with dentures, yes, you will see continued bone loss through a patient over the time that they're wearing them. I've seen patients that over 2 to 5 years that when we took teeth out, they had healthy bone, all of a sudden things really ran away. And I've seen patients that have had dentures for 30 plus years and they have more jawbone than I have with teeth. It's just, once again, I wish we could predict it. Man, if I could do that, we'd be in a much better world for all you patients, right? But I can't. The Reline, once again, that's just a refitting process, right? So even the nicest premium dentures, if you keep them for 2, 5, 10, 15 years, however long you have that, because your mouth is going to continually change, you're going to continually need to see your provider for reliner adjustments. And whether that happens on a yearly basis, every couple years, that's very patient dependent, but it is part of the process that you will have to go through as things change and your body adapts to that. The biggest challenge is this bite force. So teeth being anchored in jawbone, obviously we can all bite into an apple, corn on the cob, sandwich, all of that, right? Dentures, because they rely on suction in the mouth, and they rely on a very specific bite pattern, you almost have to train patients to re-chew. And your bite force is weakened, and it's about 30% of what a traditional, person with teeth would have. And a lot of more of the challenge is like incising into something. So like say you're gonna bite into an apple or a sandwich, right? You go to do that with a set of dentures, and as we talked about before, that will take the back of the dentures and kind of pop them down. And so that can cause a loosening of the dentures, and that's why a lot of patients will end up going in for that snap-on style of denture that I talked about a little earlier, because that'll help hold that denture in so that you can get that function back of being able to bite into a sandwich, corn on the cob, all those foods that we like to incise into. We generally will train patients with dentures when we give them dentures that you've cut the food up into small little cubes and you actually put it on both sides of your mouth and you chew on both sides simultaneously, and that will kind of force those dentures to keep them in place and allow you to chew the food as you need to. It can cause a gag reflex. We are covering the palate with dentures, and so anybody that's sensitive with a gag reflex prior to having dentures, it could potentially exacerbate that. And some patients get them and it's like, it's not a problem. Some patients are like, man, I can't wear this at all. And so I would definitely tell your provider, whoever you're choosing to go through this with, like if that's a concern for you, I would bring that up prior to starting, because we may have to treat and plan different, a different style of prosthetic for you. That will change. It should change the way we think about how we're going to select the right prosthetic for you personally. And then we say potential for ongoing oral health issues. It's more, not necessarily, obviously, getting those bad teeth out is a great thing for your body, right? But more along the lines of like, because your bite force is reduced, it can cause an issue with chewing food and getting all the nutrients that you really need with removable prosthetics. And so this is pretty minor. You're doing the big thing and the good thing by getting those infected teeth out, but this can be something down the road if you start to struggle with chewing your food and getting those nutrients. That's kind of what we want to talk about here. And hey, if this video about dentures has been helpful to you and you really think that this information may help others in your similar situation, help us and hit subscribe. Now to get into what we do here at Nuvia, dental implants. I want to kind of go over the different types of dental implants. These first two that we're going to talk about, we don't treat implant here at Nuvia. We focus on this kind of, we call it full arch, all on 4, all on X, that style of treatment. So the first kind of dental implant that you'll see is just single tooth, right? So, hey, I've got one bad tooth and doc says, hey, we need to take that tooth out, and they may either bone graft it, and the treatment plan for that is kind of like, okay, we'll take the tooth out, we're either gonna bone graft and wait, and then go in and put the implant in, or you can get what's called an immediate implant, which is where if the jawbone's available and we can get the implant into a favorable position, we can take the tooth out and put an implant in the same day. that's going to kind of cut down on the treatment time. It's also going to save some of the gum tissue. You know, a really challenging thing in the world of single tooth dentistry, right, is like making sure, especially in the front teeth, those are always the hardest, is like making sure that the gums line up with the teeth next to it. You know, I'm sure everybody has seen somebody that's like smiled and they got one tooth that's significantly taller than the next. And that can be a significant challenge in the world of dental implant, you know, single tooth dental implants. And so that's why immediates can be favorable. So if your doc is kind of treatment planning an immediate implant, you know, and they have confidence in their ability, it's not a bad thing to do. But, you know, the implant, you can see it's shaped like a tooth root. You know, it's essentially just a little screw, right? We place a screw in the jaw. We put it, you know, we won't put a tooth on that immediately. Because of the way that dental implants heal, it's kind of like a broken bone, right? You break your bone, they're gonna put you in a cast. You need that to be stable. You know, you don't want any movement over the time of healing. So if we were to put a tooth immediately on a single tooth implant, right, those forces, you know, when you bite, not only do you have up and down forces, but you have some side to side forces. That will cause little micro movements in the implant and reduce its stability, and that will affect the healing, and it may cause it to fail. So that's the reason why, you know, you'll hear places like, oh, teeth in a day, or, you know, and then you'll go in, oh, I've got to get a single tooth. You realize like, this can take a lot longer than this style of treatment, and it's just due to these implants are all attached together by a set of teeth, so that kind of prevents their movement. This one being a single tooth, that tooth will still move and that implant can move, so we've got to let that implant heal in the bone before we can put a tooth on it. The other style is a dental implant bridge. So this would be something that gets treatment planned. I mean, most people know what like a dental bridge is, right? Where you got two teeth, they prep them like crowns, and then that, you know, these three teeth would go on natural teeth. Well, the other option, and this kind of goes back to that partial denture that we were talking about too, this can even take the place of that partial denture. You can put a couple dental implants in there, and then you would just put 3, 4, 5 teeth on those 2 to 3 dental implants, and that would act as a bridge. And that's just gonna kind of replace a section of teeth that are missing in your mouth, right? And so same thing though, these have to go in, they have to heal for 4 months, and then we come back, retake impressions, and then replace that section of teeth that go on there. Both of these are wonderful options. Like if you're only missing one tooth, you're missing a couple, and the other teeth are really healthy, these are really wonderful options, because as a doc, I don't have to prep another tooth, so I don't have to take a burr, you know, and remove any tooth material to put a bridge on it. So it kind of saves your natural teeth. This also acts more like a natural tooth. You know, you're not having to worry about that space that's there. You're not having to sacrifice another tooth in order to get that one tooth back. So it's a great treatment plan for people that are only missing, you know, a couple teeth here, maybe one tooth, maybe a little section of tooth here. Now to kind of get into what we do here at Nuvia. And this is what we have treated thousands and thousands of patients, and this is called all on X. You might hear it, all on X, all on 4, teeth in a day, next day teeth, next day smile. I mean, there's hundreds of ways to talk about this prosthetic and the name of it. And the reason is we call it all on X or all on 4 is we need, you know, 4 to 6 dental implants, and we place those in the jaw in very specific spots, and then we put a brand new set of a full arch. So generally it's first molar to first molar, 10 teeth, 12 teeth, and that would take the place of somebody that if you needed to have all of your teeth removed, this is a great option for that. You know, it's similar to the denture, but this is fixed. So meaning that it doesn't move. So, and in a lot of cases when those implants go in, those teeth can go on either the same day or the very next day. We here at Nuvia, we deliver a permanent solution the very next day for ours. And then that just means that you have fixed teeth, nothing's moving, and you know, your chewing forces and your chewing function gets rehabilitated to 90 to 95% of what it was before you walked in through the door. All right, I kind of want to talk about some of the major pros of dental implant treatment. So dental implant treatment is more of a permanent solution. You know, as long as you're healthy, you know, you take good care of it, you do your hygiene, everything needs maintenance in life, right? Like these can really last a long time, and hopefully for the rest of your life, depending on, you know, obviously it really depends on you taking care of it. They prevent bone loss. Like I talked about earlier in the video, where the body really needs something to stimulate and tell it to keep use the energy to keep that jawbone around. They will act kind of like a tooth root in an instance that the body will realize, okay, something's there, something's pushing force on that. I need to continue to keep this bone around because it's being used to support a structure. It does restore full function. So, you know, in terms of the denture, we talked about 30% chewing force, right? A full arch of dental teeth, or even, a bridge, you're getting back into that 95, 98, 99% function. You really would have to really struggle to find somebody that says they can't chew what they want to chew with a set of dentures. And in a lot of cases, patients can actually chew harder with this set of teeth, and we have to kind of build that in when we make these, because with our natural teeth, like if you guys were to, you could feel a little human hair, you can feel a little piece of, paper, right? That feeling does kind of go away with this. And then also, if you were to like squeeze on your teeth real hard, say you're sitting in your chair watching this video and you just, your body's saying like, hey, like stop. It's, there's that pain response that's telling me like, hey, you don't need to squeeze this hard, right? Well, with full arch and dental implants, they don't have a nerve ending. So you kind of, they do lose that feeling, right? So patients can squeeze hard, they can chew hard. And so a lot of times we are retraining people like, hey, you don't have to chew as hard. The food's already cooked. You don't need to, kill that cow too. You can, the burger's already ready and cooked for you. You can, you don't have to go after it. And then also, if you're healthy, you don't smoke, you don't have any other predisposed conditions, an implant's a 97% success rate. At Nuvia, we actually have ours a little more. So we're right now, over the years that we've, collected our data, we're at 99% success rate, meaning that the implants we place are still in those patients today. All right, I kind of wanted to review a couple different timelines. So I kind of review the timeline of, if you were to visit a provider that's non-Nuvia provider, and then kind of go over in the next slide, what would be your timeline if you were to come to a Nuvia office. And this is talking about full arch, all on 4, all on X. This isn't necessarily even talking about the single or the bridges anymore. Now we've kind of shifted our focus to those full sets of teeth on 4 to 6 dental implants. So as we call it, the traditional teeth in a day method. And so you're always going to go through your initial records appointment. And that's going to happen on surgery day, whether you visit a provider that's us or whether you visit one of our offices. You're going to go through there. We're going to get medical history. We're going to make sure you're safe. The patient safety is always priority. It should be a priority at every office you visit, right? We want to make sure you're healthy enough to undergo a procedure like this. But we're also at that point in time, like as a restorative doc, we're looking at where your teeth currently are. And we always ask the patient, like, do you like your teeth, right? Because some patients come to us and their teeth are in a pretty good spot. They're just in bad shape. And it's like, what do you like about your teeth? And some patients are like, look, I want to have a set of teeth just like I have right now. And then some people are like, hey, give me that Hollywood white smile, And so that appointment is really your opportunity as a patient to let those docs know what your expectations are, what you want, what your dream smile looks like, right? And so that all happens kind of before surgery. We'll also take a ton of measurements. You get a bunch of x-rays and we'll, because then the planning portion of it goes in. And then on surgery day, so that's when we come in, teeth will come out if you have teeth remaining. If you've been in a set of dentures, that's when we go in and we just kind of place the implants. And the traditional manner that's been done for a long time, we'll either take a denture, which you may have your own, or one may be made for you, and we'll do what's called a conversion on that denture. And that's where we actually take that denture and we reshape it and attach it to the implants. And that kind of acts as your prosthetic during the healing phase. You're gonna wear, and then some other offices will print, they'll call it a printed PMMA, where it goes through a 3D printing process and they'll attach that. And so there's a number of different ways that that a teeth in a day can be temporized. Every office has a little different workflow. It just depends on what the docs are comfortable using. And if they're using a lab, what the lab is comfortable doing. During that time, you're gonna wear those temps for 4 to 10 months. And it's gonna do a number of things. We're gonna check how the implants are healing, make sure the speech is there, phonetics are there, make sure everything that you're happy with those teeth. The only, one of the kind of the downfalls is that a lot of times these temporary teeth, these acrylics, these printed, they're flexible materials. And so they can lead to some breakages over the time. I mean, it doesn't always happen, but it is something that can be a part of that process in getting a true temporary set of teeth. So they go through the 4 to 10 months. And then when you're done with that 4 to 10 months and you've been wearing this temporary, you're gonna go through the process again to remake that final. So you're gonna go through a similar day of your records. taking the implant positions, understanding where the teeth are. We go through what's called another wax try-in, kind of like an denture appointment we were describing before, and making sure that those teeth are in the right position for you and you're happy with them, and also honing in on that, making sure your bite is stable. So, I mean, in a traditional timeline where traditional teeth in a day, it can take anywhere between 4 to 6 to 12. I've had some of my own patients, when I did it before the way we came up with here at Nuvia, I had some of my own patients in 18 months still in temporaries, as we were just trying to kind of hone the process in and get things to fit right. So it can take a little bit longer by going this route. It's not a bad route, but it can definitely take some time. All right, so we just talked about our traditional timeline. Now I kind of want to talk about what sets Nuvia apart and kind of go over we'll call it the Nuvia timeline. So we deliver a true permanent set of teeth in 24 hours. You will always go through that first records appointment. When you visit one of our offices, we're gonna do a consult, we're gonna do a restorative appointment in the same manner as you would go over here. And that's the same thing, is to go over your pricing, understand if you're really a candidate, because once again, not everybody needs to have all of their teeth removed. Like, a lot of people have healthy teeth. Just because it is a treatment option doesn't mean it's your only one. So it's worth your time to, also, this is a great treatment option, but if you feel like, hey, I've got some healthy teeth, don't always understand that, hey, if somebody wants to take them all out, visit a couple providers and, and have them give you a couple different opinions, right? But so in our process, you're gonna go through a restorative records appointment first. Same thing, meeting with your docs, understanding, what your expectations are, where do you want your teeth? What do you want your smile to look like, right? We take all those records beforehand. That'll go to our lab. So that's a big difference too, is that, like, our labs, we also develop our own prosthetics. We're not working with, an outside lab. Then on your day of surgery, you'll come in, teeth will come out, implants will go in. Our restorative docs will do a records appointment after we wake you up from surgery. We'll do a number of different records. All of that will go to our lab overnight, and that's where my current team, as I said, I run the lab now. They work overnight and deliver you a true permanent set of teeth. And so you will get those delivered the very next day. We don't go through a temporary process. We developed a way to make sure that the teeth are in the right spot and they're gonna function really, really well for you from the get-go. And so you don't have to worry about having a little softer material placed in your mouth or worried about those breakages over time. So our total time from, your day of surgery to your permanent teeth is roughly about 24 hours. We still do see you for follow-ups. It's not like, hey, you come to a Nuvia office, 24 hours, you're good to go, we let you go, right? We still want to make sure that, hey, we see you, a couple weeks later, make sure your gums are healing great, make sure the implants are looking good, right? And then we also see you at 4 months. We want to make sure you understand how to clean it. Make sure, once again, those implants have healed really, really well, and you're happy with everything that we've done for you. So it's not this, hey, we see you 24 hours, and then you're done. Like, we do want to establish that relationship and make sure that you're okay for that entire time. But in terms of what we do that's different, no temporaries. Get that final set of teeth and then you're back to living life. All right, I kind of wanted to talk about some of the costs of different dental implant treatment. So if you're looking at a single tooth, you're looking anywhere between, $3 to $5K. And as we said earlier in the video, mind you, these costs are not absolutes. Every office is going to have a little different fee, so we're just kind of giving you guys the ranges. Your All-on-X, the style that the treatment that we offer here at Nuvia, this is going to offer, this is going to vary case by case, and that includes providers, locations, even within our own centers, because whether you're a patient that just needs a top arch, you just need a bottom arch, if you need a more advanced surgery, the costs vary by those, right? And so to help you guys out, Nuvia has we've created our own cost and information guide. And if you're interested, you can just look in the link below. All right, so naturally one of the biggest questions and most frequent questions we get, right, is like, how much does this cost? We can't tell you that over the internet, right? We can't give you a price because we've got to see your individual case. That's why we encourage people to come into a Nuvia office. Well, we're going to take some x-rays. That's going to be reviewed by a doc, and they're going to look at your specific situation. And we don't have any hidden fees. Everything is included in our cost that we give to you, but we want to make sure that your case is diagnosed correctly and that you're getting the treatment that you both need, and deserve when you are visiting one of our offices. All right, so as we did previously in the video, I want to talk about some of the cons or challenges that can come about with dental implant treatment. You know, it can happen just the same as it does with dentures, right? So once again, I don't love the word cons because this is still an investment in your health, right? But these are some of the challenges that, you know, can be brought about by undergoing dental implant treatment. So the investment, it may be higher than most of the other options. You know, cheaper is a wrong word to use here, right? Because like a denture is still a great treatment option. If that's what your if that's where you have to go and that's where, you know, your dental journey takes you, that can be a wonderful treatment option and you don't have to feel bad about having to make that choice. But this, you know, dental implants, it can be a little bit more expensive, right? The one thing everybody hates to talk about, implants can fail. You know, this is any medical procedure. You know, there can be complications with them. You know, even in the best of patients, my own patients, you know, I've, like I said, I don't even know how many thousands I've done at this point in time. I lost track at it, right? Like the healthiest people, sometimes implants fail. Most of the time, that's not a big deal. We take the implant out, we can put it in a new spot, we can graft things and let it heal, and then we can come back later and replace it. There are some cases where it can be challenging, but we will be honest with you. Like I always tell my patients, like if they came to me and a patient has waited years and years and years and they've had a ton of bone loss, and I only have one shot at this surgery, I'm gonna tell you that. Like I'm gonna sit down in the chair, I wanna be real with you because I want the patients to understand, like, not only is this a challenge for me and a challenge for them, like I want them to have the true honest opinion and the true honest potentials, right? It's, you know, it would be not truthful of me to not tell a patient like, hey, like we have one shot at this and this is, you know, and we got to make sure that you take care of it. I'm going to do the things to the best of my ability. But like, look, if an implant does fail, we may have to get back into a set of dentures. And so, but we will tell you that, like you deserve that as a patient. We want to make sure that you're informed. But overall, you got to remember, implants in non-smokers, people who are healthy, we get 97% success rate, right? There are very few medical procedures out there that are 97% success rate. And at Nuvia, once again, ours is even higher than that. We're at 99. So if we tell you things that can work out and we feel like, and you're willing to partner with us, because remember, this is a partnership. It's kind of like buying a car. You can't just drive it off the lot and not put oil, not put tires, not take care of it, right? You still got to clean these. You still got to visit us for follow-ups. Like all of those things are the maintenance of this. It still requires maintenance, and that's all part of the treatment. And then when you do visit a provider that's a non-Nuvia provider, remember that you can be in a long treatment timeline. You can be 4, 6, 10, 12 months or even longer. That's kind of the benefit of coming to a Nuvia office, is that you can get that permanent set of teeth the very next day. And after our follow-ups, you're on your way and you're back to living life. All right, so I know I just talked about, hey, implants can fail. If you guys have any questions about that, we did actually make a video which you can check out right here. I appreciate you guys spending some time with me today, kind of learn about, you know, the differences between dentures and implants, and you know, remember that like denture is not a bad option. If that's what you're, you know, if that's what's been treatment planned, that's what you can afford, and that's what, you know, that's where your dental journey is going to take you. Like, great, you know, find a provider that can make you a really nice set of dentures, and then maybe in a couple years we'll see and we can help you out with dental implants, right? Making those things fit a little better. If you have questions or if you want to explore dental implant treatment, we would love to see you inside of one of our Nuvia offices. We've got them all over the country now, so there's probably one that's pretty close by to yourself. And the other thing is too, is like, say you got a treatment plan from an outside provider, right? And you're kind of questioning like, is this my only option? Is this really the best thing for me? We offer free consultations. You know, give us a call, fill out our online survey, right? And we'll come in, we'll take your x-ray, we'll have one of the docs take a look, and you can even bring the treatment plan and say, hey, is this legitimate, or is there something else that's going to be better for me? So once again, I'm Dr. Jordan Heimer with Nuvia Dental Implant Center. Thanks for spending some time with me, and we'll see you in the next video.